You got, where is, which one? Okay, just let me know. All right, we're going to go ahead and get started. I appreciate everybody that came down in person, and I understand those with their schedules that couldn't be, but we've got the best of both worlds here. So we'll get the meeting started. If Representative Grigsby's can hear me, if you'll go ahead and open us in prayer, I'd appreciate it.
Thank you, Mr. Chairman. Can everybody hear me okay?
Yes.
All right, if you don't mind, let's pray together. Lord, we thank you for this day. Lord, there's not lost on me the troubles of this world and the number of people in this meeting, Lord. Each of us have our own burdens to bear and things that we're carrying, Lord. I just pray that you be with us during this time. You take the cares of this world, allow us to focus our attention on this matter of our first responders, Lord, and how they serve us so well. Even in this hour, Lord, I pray protection over them. I thank you for their lives, for their sacrifice, for their families that support them. Lord, I thank you for this committee as we look at this issue that you laid before us. Lord, give us discernment, direction, and the ability to carry out what needs to be done. Lord, I thank you for our chairman and for this committee. In your name we pray. Amen.
Amen. Thank you. Clerk, call the roll.
As I do roll call, if you're here for an appointee or a designee of someone, please state your name so that we can have that for the official record, okay? Thank you. Representative Treadaway.
Here.
Representative Rigsby.
Here.
Senator Gudger. Senator Bobby Singleton. Senator Bell. Representative Tillman. Commissioner Boswell.
Nicole Walden, proxy for Commissioner Boswell.
Director Brasfield.
Lauren Hodge, representing Westfield.
Director Cochran. Director Matt Russell.
Present.
Captain Jeremy Burkett.
Sam Adams here representing Aaliyah.
We have a quorum.
Thank you. All right, we'll move into the old business. And basically, first I want to thank LSA and Jeff Condra and Shenika, our clerk, because getting the feedback proved to be pretty difficult and took a while, and that's the reason we haven't had a meeting. I didn't feel like we should until we got most of the surveys back, and we wrapped our head around all of that. And so towards the end there, I had to get on the phone personally and get folks to get those surveys in. And so most of us we have them. You should have had them distributed to you by now and had time to look at them. And we'll move in the listening from each member of this commission on the getting their input on that. Now, I do want to make sure everybody knows. I was looking at this resolution and what we are actually tasked with. And it's pretty clear the Interim Study Commission on PTSD in first responders to study how state, county, and municipal governments may utilize available funding more effectively and to provide services to first responders who have acquired PTSD. That don't mean we're not going to. I've got something later in the meeting I want to talk about that's really not what we're tasked with, but it's something that I felt was needed and a piece of legislation that most likely would be a standalone piece of legislation. So, new business, we'll move into the new business and hear from each commissioner. And I guess the clerk, if you want to call them and kind of get each person's input on kind of where we're at and what you think about and what we need to do. I'm open to all suggestions on this. So if you'll go ahead, clerk, and we'll call each one and see where we're at and if they make sure they've received everything and where we're at.
Just want to do commissioners only or everyone on the commission?
Do what?
You want to do everybody or just
Yeah.
our commissioners?
And if they don't have anything, they're sitting in for somebody, we can just move to the next one. I just want to hear from each one of the commissioners before we actually get started.
Okay, Representative Rigsby, do you have any input or insight?
I'll wait and hear from everyone before I share.
Okay, Representative Tillman? We can't hear you.
Okay.
Okay.
Can we turn that up? Okay.
Ms. Walden for Commissioner Boswell. Ms. Hodge for Director Brassfield.
Yes, ma'am, and thank you, Mr. Chairman. Looking at the county surveys that were returned, it seems like, our folks need better education on what resources are available to them. 55 of our 67 counties participate in our local government health insurance plan that provides some mental health resources at no cost to the participant. That in particular, I feel like could be communicated better to our law enforcement community so that those resources are utilized on a greater level. So that's, just preliminary results based on what was returned in the surveys.
Okay.
Mr. Shedd for Senator Gudger.
Well, thank you, Mr. Chairman and members. Senator Gutcher feels very strongly about what this commission is doing and stands ready and willing to assist and help address the problems of PTSD and first responders. And thank you for your work, Mr. Chairman, and just let us know how we can be able to help, and we'll continue to follow the meeting and try to be open.
Director Greg Cochran or Mr. Caleb Beck for the League of Municipalities.
Is he here? Can you hear us? Oh, ask him again.
Director Matt Russell for the Alabama Fire College.
Yes, ma'am. Representative Troy, thank you for assembling this group. So this is a vitally important function for the Alabama Fire College and for peer support members of the fire service in Alabama. So just a brief history about the fire college. The way we got started with peer support and behavioral health is that it was incorporated into our National Fire Protection Association standard. And so we were required as an accredited agency to continue offering certification courses to incorporate peer support behavioral health into our programs. And so we were mandated basically to do this. And so we piggybacked off the Professional Firefighters of Alabama, and it's been a wild success. We were very fortunate to collaborate with Alabama Department of Mental Health to secure just a bit of funding. We also have some funding, 50% collected fee for distinctive firefighter license plates, which gives us about $19,000 a year. But that is woefully inadequate to do the things that we need to do with peer support in Alabama. So with the money that we've received thus far, we've trained over 2,000 firefighters, emergency responders, firefighters in awareness level operations, and we also have over 235 that are peer support members with the little bit of funding that we've attained so far. So we're very glad to be participating in this program and hope that we can, really three things we need to do. We would like to see more collaborative effort between law enforcement, Department of Mental Health, and the fire service. We need to programs. And then really just a more collaborative effort. And then statewide protocols really to help consolidate the efforts because I think it's bad governance for us to continue to do three separate, everybody doing their own thing. I think it would be much more efficient and effective if we could collaborate on these processes between mental health, law enforcement, and fire service.
Shenika, can you hear me?
Yes. Yes.
Sorry, I was having technical difficulties earlier. This is Caleb Beck with the lead. If you don't mind, maybe Mr. Jones, I want to chime in and give our thoughts from the municipal level. I just wanted to reiterate that our report says that education seems to be one of the key factors here. There's a lot of resources available that maybe we can educate our members about pushing out to our law enforcement community. I think the questionnaire also highlights that a lot of our cities are different and they provide the resources they can based upon the resources they have at the local level.
Thank you. And Mr. Samuel Adams for Aaliyah for Captain Jeremy Burkett.
Not to sound like a broken record, but similar to what has been said, more awareness of the supports that are there, especially the LEAPS program that could use more awareness among law enforcement, and that's the law enforcement peer support program. So that's our major piece that we honed in on at Aaliyah was the need to promote that resource and as well as EAP that's available for our sworn officers in the LEAPS program because I think peer support is key to this area. To talk to somebody that's had similar experiences was what we gathered. So.
We'll go back to the ones that wanted to wait. Representative Grigsby, if you want to go ahead and chime in now.
Yeah, I thought it was very interesting. Like you, Mr. Chairman, that served as a first responder myself, looking at some of the responses that we got from the different entities. And you know, one of the things that I want to make sure that we really address is putting something that's practical and will be utilized. There was a couple comments on several of the responses of, you know, no one had been diagnosed, and I'll use that example if you can't see that, with PTSD. And part of the reasoning that I kind of read between the lines was because, you know, there is some stigma of if I get this diagnosis, then I may not be able to be seen as being fit for duty. And we've got to fix that. I don't know how we go about making sure that the resources and the finances we put in place to do the peer support, which I think is probably the right way to go based on what I'm hearing in the room and what I saw in the responses. But we want to make sure that we put something in place that doesn't have a stigma around it so that it is utilized. I really want to be cautious about throwing money at something or efforts at something and it not being utilized because of that issue. We've got to get past this issue of being fit for duty. You know, I think PTSD is a real thing. I think we need to make sure that it's addressed and the resources are available. But we also got to make sure that we do this in the right way so that these men and women who are putting their life on the line, who are having to see these horrible incidents day in and day out, are being able to continue to provide for their family. And we just want to make sure, at least that was what was impressed upon me when I looked at these responses, was making sure that we don't take away a livelihood because we now have a label or a diagnosis. And I was really, really taken aback with, you know, the response was how many people have been diagnosed, and almost across the board it was zero, which I would find that very difficult to believe. But I understand why it is that way. So let's just, you know, whatever we do, make sure that we put, you know, things in place so we keep our men and women on the front lines if that's where they need to be.
Thank
Has
you.
everybody had an opportunity to speak up, wanted to speak up at this point? And I couldn't agree with Representative Rigsby more. And that's what my takeaway was also. First of all, there's a lot of, or a number of services that out there that are very helpful. And as the fire college is doing, we need to coordinate all of these services, and we have to have them, and I believe, centrally located, where whether you're in Birmingham or Montgomery or some rural sheriff office or fire department, how do they access it, and how do they get those services, and how do we fund it? And I'm hearing, and I want to hear more about your ideas on the funding, what it would take to do that. And I need the Alabama Department of Mental Health, because I personally believe that's where this needs to come from. As far as anybody that needs these type services, that's the place they're going to contact. And from there, what's available and how that looks. So that's kind of, as I look at these surveys and being in law enforcement 31 years, I've noticed where I was in law enforcement, we had services. I mean, the city of Birmingham provides a number of services, but in speaking to others, they may have a program here or there, but they don't have the type of services that may be needed. And I also agree on the stigma, how we address that, because there's probably a lot of folks out there are suffering that are way too concerned about having a department know that, or that they're having services currently addressing that. I'm not a clinician, I'm not a doctor of any kind, but I've also seen or read that there's a lot of different levels of PTSD, and not all of them, or most of them, do not prevent you from working. Well, that brings me back to the League of Municipalities and the county commissioners. They're concerned of the whole liability issue and how we address that. And so I don't have the answers to all that. We'll try to seek them out through the various groups that are here and LSA, and how we can address that. So I'm open to any suggestions on that, but that's kind of my take. I think that we can do a lot better. We have programs out there. They're kind of working in their own little silo, and that shouldn't be happening. And those services should be readily available to anybody in the state. And I personally think that can happen. But the stigma issue, the liability issue are going to be something that we've got to be thinking about going forward before our next meeting. And I'll task LSA on addressing that as far as what others are doing. The county commissioners, we need more input on that. What are others doing, and how does that look? Because I think we all agree dealing with public safety officers that are out here putting their lives on the line is priority, and how we get them what they need and address the concerns that are out there. Is there anybody got any questions on any of that? Because this is, like I said, this is an open meeting. Let's talk about it. I'm sure there's folks around this table and that know of programs that are working and how we can get those out there and how we can fund them. So,
Representative Tillman had a question.
I do agree. I think that the central located place for our first responders to go would be critical. Also, the funding issue, I wanted to inquire about that, as well as protecting our first responders from the liability issue, to make sure that they submit to the program and submit to the treatment, that we show them that we are concerned about your overall mental health as well as your physical health to actually do your job. And we need to make sure that we do have protections in place. So that kind of helps with the stigma, erasing the stigma, so that if you are seeking this type of treatment, it's okay to seek this type of treatment. And this is what Alabama is doing for you, to let you know that these funds are available, these resources are available. Reading through the questionnaire was eye-opening to me, because I learned a lot about that. And I'm really high on the peer support program. I see that. I think that's kind of prevalent in a lot of the resources that are available. I think that's something that we need to kind of focus on and allow to be a big piece. People who have gone through something that's similar to you, that's doing the same job that you're doing, I think can be invaluable. So I think this commission is a great tool, and I think once we can get things hammered down, I think it would be great for our first responders in the state of Alabama.
Okay. Anybody else before I introduce our speakers?
Mr. Chairman, Pete Grogan from LSA. So, one of the things that when I went through this, looking at what mental health offers, rather than, I would suggest, rather than focusing on a central location, is there a way to piggyback off the regional crisis centers that mental health already has established throughout the state and the rural centers? That way you don't have someone from North Alabama having to travel to Montgomery or whatever. If they're available and if there are people there who can help. And I look at, I spent 20 years in the Marine Corps, so I'm kind of familiar with PTSD and that kind of stuff. But I look at, if you start out at the bottom level, peer support, and they can't address the issue adequately, then perhaps the next step is, okay, can they get into one of these crisis centers, rather so that you have someone seen before they decide they have to kick the dog or, punch a hole in the wall because they can't deal with whatever the issue is. I throw that out there that rather than trying to consolidate everything at one location, which is going to cost money, utilize what's out there. But again, I don't know the functions, from the mental health perspective. Can they cover something like that with everything, how those are being used now? I throw that out there as a potential option.
Mr. Chairman, we wondered, the crisis intervention training that's available to our law enforcement community has been so greatly received. It is a vital resource for our law enforcement officers on the county government level. And Mr. Johnny Hollingsworth, who administers that program, we were fortunate enough to host 2 sessions at our office for county deputies. And I wondered if that program, were it to receive additional funding, could that be expanded so we could have a train the trainer related to peer support? And so that way, there are people in every region. There are people locally that can support their law enforcement peers. And because Johnny's done such a great job of the train the trainer with the crisis intervention training model. So I just wondered if that could be expanded, if properly funded, to address this issue as well.
Thank you for that input. Listen, and I didn't mean mental health being handling all these organizations, but being the area, if someone called and there was a peer group in that area, then that would be something that they would guide them to. If there's not, then what is available? So somebody has to, the fire college does an excellent job. Look at the folks they've trained, but they're not everywhere. So, and then you got the law enforcement peer group, and I just think they should be working together, and there should be an updated list of all the services, not suggesting that mental health provides all of that, but just like you're talking about another organization, I've never heard of them. So we need these organizations we need to know about. So who's going to manage that? So if you got a great organization here, it works where? North Alabama? I don't know. I don't know anything about it. It's the first time I heard it. So there's a lot of services out there. How do we corral all that? How do we manage it? How do we see what's working and not working? And how do we provide that to public safety officers? And that's where I was going with a central location. And I don't know how that would look, but mental health, you talked about a program there that's working. I've never heard of that one. So how do we get these programs, if I've never heard of it and been in law enforcement as long as I have and been down here, that's part of the problem. We don't have a place that can disseminate all this information, and that's what I'm talking about. Well, who would do that? We're talking about a mental health crisis. Then to me, I personally believe, when I'm looking and reading all this and all the different groups out there and all the great things I hear about them, and hear about one today that I knew nothing about, who manages all that information, and how do we get it out timely to the folks that actually need it? And if you've got the fire college, you got law enforcement, you got mental health, you got this program, we're going to hear from another program, then who manages that? Where would that be deposited, all that information? And then who would you call to get it out? That's kind of my thoughts on that and I still believe that would be the Department of Mental Health right now. And what funding would they need? What additional funding does a fire college need? But, you know, we don't need to fund all of these different groups. We need somebody to manage that, and maybe the funding goes there, and they manage how successful, effective these organizations are. So some of my thoughts, that's just where I'm at when I look at all of this and see all the different, some of the surveys came back and they had 5 or 6 different services. Some of them came back and just had peer support, you know. So to me, I'm thinking, well, that's kind of the problem too, right there. And I'm hearing about these different organizations.
And I was just thinking, as a representative from the Department of Mental Health, there's an app called the Connect Alabama app where you could put these type of resources on there. And because of the way it's structured, it would be things that were continually validated. So it wouldn't be, sometimes we know we get fly-by-night organizations that say they're offering things, but you could have really well-established things, which would make it available to people in the field to be able to say, right then, let me look here and where can I go? To speak to the crisis centers, yes, that I think that's a good tie-in. That would be some training we would need to do a little bit more on. And then as we move towards changing our models of care to something called Certified Community Behavioral Clinics, CCBHCs, one of their tasks is they have to serve veterans, and it feels like all of this comes in together. So I think that's something that needs to be discussed as part of that, because that could definitely be tied in along with the CIT, because I think that's a great idea with Johnny.
Mr. Chairman, if I could.
Yes, go ahead.
I agree with what's being said. I think that, to me, the appropriate term would be for mental health to facilitate the process, because the fact is, law enforcement don't want fire department telling them what to do. So I don't think we need to lose our autonomy in that, but I think if they could facilitate the process, one of the things in doing some research, exactly what you're saying, there's dashboards or websites available that you could consolidate these resources where if you have an issue, everybody could go to that one place, mental health, ideally, probably, where they could access those resources and then know what's available. One of the things that we have done, because we've trained over 2,235 peer support members, we have resources from Mobile to Muscle Shoals, and we're now segregating those geographically so that we don't have to travel from Birmingham to other places. So we're already doing that geographically, and I would love to get with Johnny, your guy, for us to have that conversation if we could.
Let me interrupt. So he's not my guy, although we will claim him any day. Johnny actually works in conjunction with the Department of Mental Health. This is a program that's funded through our general fund budget. It's an appropriation that was actually, we worked to increase last session so that more county government law enforcement personnel could receive this training. So it's actually mental health's guy, but we'll claim him.
Also, Mr. Rigsby from the Fire College has a question.
Yes, thank you, Mr. Chairman, for putting this all together. I want to briefly introduce myself real quick. So I'm with the Alabama Fire College. I'm the program manager for the peer support program that we have there. We came to the Fire College from the PFFA, which we started this program about 8 or 9 years ago. I love that we're having this conversation, and it's a conversation we've been having with ourselves for quite a while. I believe that the Alabama Department of Health is a big part of this equation. As Director Russell said, first responders are first responders, but we're all a little different, right? And so I think it's important that the autonomy that Director Russell was talking about with the fire and the police and the veterans and all that stay in place. But I think that the resources that we all pull from could come from the Alabama Department of Mental Health. And I say that because when we started peer support, it was firefighters talking to firefighters, first responders talking to first responders. And as we got farther into it, we realized that there are a lot of scenarios in which our brothers and sisters need help beyond what we can provide. And that comes in the package of a clinician and a therapist, right? So we have to have the resources to refer to. We have a clinical director on staff that's 24/7 that we can call when we have situations, whether it be suicidal people or what have you, and we can get that person on the phone really fast and get, find some type of resolution. But we can't do that unless we have trained mental health staff available to us. We just held our second annual clinician awareness program trained about 35 or 36 mental health providers in the state to what a firefighter is, the culture, how we respond to treatments, the way that we're different than, say, an average citizen and what we go through and the deals with trauma and us and how we work through that. And so for me, on behalf of my program, it's very important for us to have that. And I've thought about the 6 regional centers as being a great start. We've had conversation about starting to have a clinician awareness training and bring clinicians in from all of those locations. Because there is a difference in a clinician and a culturally competent clinician. We've seen that. If we can vet these therapists and these clinicians to what our culture is, I can go to one of my brother or sister firefighters and say, look, talk to this person. They get it. They understand it. And that is a huge part of this program. I am 1,000% peer support. And prevention is how we prevent PTSD. We can't prevent it all, but the resources is what is we need to be able to share with people. And that's what we've been successful with at the fire college. And I won't say anything else right now. But thank you.
Thank you. Anybody else? What I'm going to do now is introduce our speakers and really just let them introduce the program. I've asked the Alabama Department of Mental Health on what services they provide for PTSD if the situation came up, and this group was mentioned, and thought it would be the appropriate time to bring them in and let them talk about what they're doing. And that would be Mr. Jason Smith, and it's the director of the Veterans Program Development of Florida Springs Wellness and Recovery Center. And if you guys would try to limit it to about 10, 15 minutes, and then we'll open up for questions from a member of the commission. So.
Appreciate it. Good morning, everybody. My name's Jason Smith. I'm also a retired Marine for 20 years in active duty. I also started a program here in the state of Alabama called Safely Together for lethal means safety. You may have heard about that. The subject we're talking about today is near and dear to my heart. I worked for the National Guard up until yesterday. That was my last day there. They cut off our resiliency program, unfortunately. However, after my 20 years of service and getting out, I've lost 8 Marines to suicide, and I've also lost probably a dozen or more to overdose from not only drugs and alcohol combined, but also prescription medication. And one thing that I look at, if you know about the numbers of OIF and OEF, that's Operation Iraqi Freedom, Operation Enduring Freedom, we lost over 6,500 service members in combat operations. In that same time, we lost anywhere from 4 to 8 times as many to suicide in this country. So when you ask what's the #1 enemy right now, it's not Hezbollah, the Taliban, or Al-Qaeda, it's stigma. And I heard it was brought up on this call when I walked in. I was so glad somebody said it, because we know that's the problem. But before we do throw money at things, and this program we're about to talk to is an awesome program, you have to have policy in place. They have to know what they can and can't report, what's fact and what's myth. And what I find out working with the National Guard is there's a lot of myth when it comes to mental health care. For example, if I break my leg, I'm going to be put in rehab for 3 months on my leg to get my leg better before I can deploy. If you have a mental health issue, the same rule applies. But a lot of us think if I say something about something, I'm not going to be able to deploy my Marines. I'm not going to be able to check my weapon out of the armory. I'm not ever going to be able to do my job. So guess what they do? They compartmentalize and they hold on to stuff. And what happens is, especially with first responders and veterans, and the reason I'm talking first is because I'm going to turn it over to Alan in a minute, is a lot of our veterans leave their organizations as service members and join the first responder ranks. And I bet right now, if y'all counted how many veterans you have amongst your ranks, you'd be surprised. And I would bet that half of them have never been to the VA. Now, with that said, the policy has to state the difference between myths and facts. One thing we did at the Alabama National Guard, Chairman, is we did a destigmatizing mental health memo from the 2-star General Pritchett, identifying those specific areas that apply to service members and the things that we worry about. Our security clearance, our ability to keep our Second Amendment right, our ability to deploy with our brothers and sisters, which is probably the #1 thing. And I think from that perspective, and whoever said it, we don't want to throw money until we have a policy. I think that's the #1 thing that we need to look at. We also talk about post-traumatic stress, and we hear that a lot. And if you've ever heard the saying, what doesn't kill us makes us stronger, I haven't met a person who's gone through trials and tribulations who didn't come out better on the other side for working through their trauma. These first responders need to be given the opportunity to work through their trauma because they're seeing it. I sat down with the fire chief from Montgomery last Sunday night for dinner. There were 2 shootings, 2 deaths in Montgomery. The firefighters showed up, and there was 1 injured. It was their first week. 2 of them had just got out of the academy, 22 and 23 years old. So imagine what they're thinking right now, walking up on the scene and seeing that. It's not if trauma is going to happen to all of us in this room. Trauma is going to happen. It's how are we going to handle it? And I think it is about our prevention, training us how to deal with that stress prior to us getting, before we get out and then try to deal with it on our own, because we have poor coping skills, both in the first responder and veteran community. Our level of alcohol use, substance use disorder is higher than the civilian population. Our higher divorce rate is higher in the military and first responder population. And I could go on and on. The one fact about all that is none of us want to report anything or talk that we have a problem or report that we have PTSD. I remember getting back from Ramadi, my first tour, and when I got off the bus, we had a psychologist sitting there with a PHA, a post-health assessment, asking us all kind of crazy questions. If we saw this, saw that, do you think any of us got off that bus wanting to talk about that at that moment? No, because we're getting ready to deploy in those 6 months, and nobody wanted to be pulled off a deployment, so we just go on and on with that stuff. So we got involved with an organization called Boulder Crest. You are going to hear from Alan today about a program called Struggle Well, which is specifically for first responders and active duty military. It's something we were trying to bring to the Guard. There's another program that Boulder Crest hosts. It's called Warrior Path, and that's for veterans. It's a 7-day program. I went through it myself. They paid for everything. If you've ever heard of Gary Sneed's Foundation, Gary Sneed's, the CEO of Home Depot and the CEO of Boeing, put about $50 million in this program 15 years ago, and it has grown expeditiously. So we're hoping today you take what Alan's about to tell you about this program and what he's put some of your officers and first responders and military in the state of Alabama through, and take it for consideration in one of your programs. And Chairman, thanks for your time to let me talk. I appreciate it. Thank you.
Good morning. Thank y'all for your time. My name is Alan Hendricks, and wanted to tell you a little more about my backstory so that you understand what I'm talking about when I'm talking about these programs. Currently, I'm a police officer in Dothan, Alabama, so I'm a field training officer. So let's back up to 1999 when I started my career. I went through a lot of things, became an alcoholic, married my wife, currently wife, 3 times because of my infidelity and bad choices. 2015, I hit rock bottom after being involved in a shooting. I checked into inpatient rehab and sober ever since. Once I got back, the wife and I decided we wanted to help first responders. We then began building programs we currently teach across Alabama. We teach it together from the stance of, she's standing here with me, so you can't say what I'm telling you ain't the truth, right? And we talk about openly the infidelity, the bad choices, the alcoholism. We teach a 4-hour class across Alabama and have been doing so for 2 years at no cost to first responders. Thank you to Jacksonville State Director Caleb Littlejohn funds that. During that program, I began looking at other options of what can we do for others. So that's when we started wanting the goal of bringing 8 programs to Alabama for first responders. We began looking around, and we've successfully brought 8 currently to Alabama that is recognized by ours. I did meet Johnny Hollingsworth that y'all are talking about. I am a member of the CIT team and training coordinator for Region 6. And that's how I kind of got into all of this too, is we got talking about mental health. And a section of that CIT training has mental wellness for officers. The big problem we found is we wanted to be sure that every program we brought involves the spouse. Every program that we offer, the spouse is invited because they see the problems. They need to be a part of the solution. So we began doing programs. Struggle Well is currently taught, this book right here, it's called Struggle Well. This program is a 1-day for supervisors, a 2-day for officers, or a 5-day. It's about the person. So we're not teaching you how to be a firefighter. We're not teaching you how to be a cop. We like the mixtures. It's about PTG instead of PTSD, post-traumatic growth. It is under the philosophy that if we look at the destruction that caused the trauma, that good things can come from that, and that can then be the catalyst for change. So trauma does not have to be the end of it, right? So we can take that trauma and let it be the new things. Currently in Alabama, we are running this program through Jacksonville State for best practices. Myself and Michael Green with the Alabama State Fire Marshal's Office are the only 2 certified guides in Alabama. This program has already been taught 5 times in Alabama to corrections, police, dispatch, administration, and spouses. So over the past year, Michael and I have traveled the state of Alabama, spending our own money for hotels and gas. And we're at the point that we want to continue the program Jacksonville State runs it for us for registration, but we're looking for how do we get it funded for guides, right? On behalf of Boulder Crest Foundation, what I will tell you today, for every class that we teach, we will provide them with this Struggle Well book. They get that. They get a bracelet, a challenge coin, and a workbook, and a wellness app for life. That comes all from Boulder Crest. So all we have to cover is the guides. It's a max of 25, minimum of 12 per class, because we're working through a lot of things, right? We don't want to have over 25 people. And like I said, we currently work it through Center for Best Practices, and they're looking at, can they fund this for us? We do have a short video that they can play right now, which is the CEO, Josh Goldberg. We'll go into a few things. It's about a 5-minute video.
In 1995, two psychologists, Dr. Richard Tedeschi and Dr. Lawrence Calhoun, coined the term post-traumatic growth to describe all they had learned from a decade of interviewing people who'd experienced severe traumas in their life. Rich and Lawrence's where did this come from? What they learned after the words of the ancient Greeks, all great wisdom comes from suffering. Post-traumatic growth, or PTG, is two things: a process that helps us grow in the midst of stress, struggle, hardship, and trauma, and a series of outcomes where we grow. I want to focus now on the process and the 5 phases of PTG, which enable us to walk the path from struggle to strength and to experience post-traumatic growth. These 5 phases are grounded in an environment of trust and connection. When we have people in our lives that allow us to ask hard questions, that can handle the ups and downs that come with struggle, and that don't judge us, PTG, and the journey of personal growth. As the saying goes, I have to do this on my own, but I cannot do this by myself. The first phase of the PTG process is education. Through this process, our minds begin to cultivate an acceptance of the normal and painful impacts that struggle has on our lives. And in turn, we learn about the possibilities of growth in the aftermath of such struggle. This learning normalizes what we experience and reduces the fear and shame that's an inevitable part of time. It reintroduces hope into our lives and helps us realize that how things are isn't how they happen. This reminds us that we are not irreparably broken, and that good things truly can happen after really bad.
Is now exiting.
The second phase of the PTG process is regulation. As Aristotle said, educating the mind without educating the heart is no education at all. With the help of trusted people and wellness practices, we can cultivate a sense of calm, clarity, and connectedness, which gives us the space to reflect and to respond rather than to react to all that we are navigating. This space enables us to regain a sense of control in our lives and to regain the ability to make conscious choices about what will happen next. The third phase of the PTG process is disclosure. With the hope that comes from learning about PTG and the calm and clarity that's afforded by regulation, we can begin to reflect upon and disclose about the struggle and hardship and trauma that we've experienced. And more importantly, the impact that those things have had on us in 3 areas: what we believe about ourselves, what we believe about others, and what we believe about the world and our future in that world. This is where having trusted people in our lives makes such a critical difference. The fourth phase of the PTG process is story. Doing the hard work of education, regulation, and disclosure gives us fresh visibility on that story and a fresh perspective. And it affords us the strength to pick up the pen and begin to write a new chapter, because our story is not yet fully written. The fifth phase of the PTG process is service. By making sense of our experiences, we can develop the willingness and courage to share our lessons with others, enriching their lives and helping them to struggle. We also realize, because others have been there for us, how critical it is to give back and make a positive impact in the lives of others. In the process, they grow, and so do we. As people struggle to strength within and across the phases of PTG, through patience and persistence, they're transforming their deep struggle into profound growth and are recognizing how they can live a life that's filled with hope and
Here we go again. It's not tonight. The sight of gas and diarrhea.
Sound familiar? Any of these digestive issues after eating may cause you to second guess your food choices.
Thank you. So one of the things that we did do over the past year is that we truly believe that we must keep it as a mixed culture when we're teaching this and guiding this class. And the reason we say that is we have invited DHR workers, social workers, firefighters. We want it mixed up because together they're on scenes together. If I go to a scene currently and a DHR worker there is struggling, I want to recognize that we can have a little quick conversation. Same thing with our firefighters. So we've been mixing the class up. And again, it's just a phenomenal program. And the biggest thing is to teach officers and firefighters, DHR, social workers, everyone that we can shift the culture by working together.
Thank you. Appreciate your input. I guess before we move on, there's a few things I would like to ask LSA, Fiscal Office, and the Department of Mental Health. If there's a lot of organizations that are out there, how we would corral them all into one central location as far as communicating and getting how it would look. If please maybe have something for the next meeting, make a presentation to the members of the committee here on how that would look. And these are my thoughts, and certainly anybody else here in a minute, I'd like your input on how we move forward. So if we took that, and if the fiscal office worked with LSA on what these organizations that are out there providing services that we know work, what recommendations would we be making as far as funding's concerned and what that would look like. The peer groups out there I hear, I mean, everybody feels that that's very effective. And you've got the Twin River Police, it's got theirs, you got the Fire College, and it's a Professional Firefighters Association. So how you corral all of those that we're accessing and we're using now that have limited access or we don't know about, if I'm making myself clear here, because these are my thoughts and listening to everybody and what we're doing here. What that would look like from the Alabama Department of Health heading that up, and the fiscal office on the funding, what the cost would be on what the Alabama College would be asking for, what the Department of Mental Health would be asking for to expand this. The goal is to ensure that every public safety officer has access to the treatments that they need throughout the state. And I'd appreciate that. We'll have a meeting maybe in a couple weeks or so, or whenever you feel like you've got enough information to bring back before the committee. Anybody else want to talk about that, or what thoughts you have? And by the way, Senator Lance Bell has joined us, and I've just noticed that, so didn't want to leave you out. So the floor is yours.
Well, what you just said really is the funding part, because I know we've been talking about the budget with our budget chairs, and the budget don't look good for 27, looks even worse for 28, so that's the concern I've got. I'm glad you addressed that part.
You know, and going back again to what we're tasked for, in line with that, is that, you know, it states to use existing funding, but it doesn't mean we can't make recommendations outside of that. But if these departments would get together and identify these organizations that work and are very helpful, and how they would put that together, and then how we would get it out. I mean, we're going to have to get this information out to every volunteer fire department, every police department. Needs to know where to call, and then have a drop down from there, somebody on the other line, on the other end, helping them out. So those are my kind of thoughts on this, and I'm open, the floor is open to anybody else right now. Any questions from the Alabama Department of Mental Health on putting this together for us? Okay, LSA? Any, okay. And if you'd have us, you know, I'm sure other states are doing something. There's out there as far as bringing all this information together, being able to get it out timely, and how they're funding it would be very helpful to members of this committee by the next meeting. Because I think what I'm seeing, that's where we're going with this, based on what we're tasked to do. And when I was thinking about all this, you know, we have folks out there that are no longer in the profession because of it. And if it ever reached that level, I was thinking, and I wanted y'all's thoughts on it. I had some legislation written up. It's really something I want everybody's thoughts in. We get to that point, and we know we've got folks that have not been able to go back into the profession. I just think that the state ought to have a way to put them back in the workforce. So anything that has a certification in the state, in the junior colleges or trade schools that we have, they'd be able to go. Jeff put that together for me, and I think the fiscal note or the seed money would be $1 million. But Senator Lance Bell just said it's going to be hard to get that. So what are your thoughts on that? We've got, if you looked at the bill, you know, and we had an individual that could not go back and carry a gun or work as a firefighter. What's y'all's thoughts on having, just recommending a piece of legislation that would get these folks retrained and put them back out in the workforce? Any input? Bad idea, good idea? I'm all ears.
The legislation is in your packet if you wanted to take a look at it.
Yeah, so maybe my next meeting, the legislation is in your packet that you've been sent, or if you're here, take a look at it and just kind of give me your thoughts on that. I know several officers that are no longer in the profession, and because of PTSD, it was you know, there's no, in the state law, most of you know, if you don't, in Alabama, the only way you're getting a pension out of, say, the city of Birmingham's pension system, the county, there's a few others, and then you have the state system. The only thing recognized is that you have a physical disability, and PTSD is not a physical disability recognized in the state for those folks. And those who have not were vested when these things happen, for example, with the city system that I come from, they're just out on the street. And I thought that that would be the least that we can help out with, is retrain and put them back in the workforce. So that's the kind of ideal I have, and if you get a chance, read it and let me know what you think. Anybody else? Would you like to get a couple minutes? Come on up, introduce yourself at the mic there and turn it on.
Good afternoon. My name is David Hare. I'm president of the Professional Firefighters of Alabama, and I want to thank you all for being here. This topic is very near and dear to me, as I've seen lots of firefighters suffering from this, and really hoping this moves forward for bettering our first responders in the great state. Just a couple quick pieces I've jotted down. I've sat here, like you, Mr. Chairman, sat and heard 6 different programs I've never heard of. If there's a way for maybe the Department of Mental Health to put together even a first responders committee, that you guys could meet together and share these things and see what's working, see what's not working. Another thing that we have to start touching on, and I always try to say, let's not invent the wheel, but truly with PTSD, we are inventing the wheel, and let's make sure we get it right. And one thing down the road that I think the state needs to focus on and groups need to focus on is our dispatchers, because they are sometimes forgotten. And there is a big thing when you're talking to someone on the phone on their worst day, and then you move on to the next call. There is something there that's involved, and it's something that we need to look into. Speaking of just on behalf of firefighters, I'd like to commend Director Russell and the Alabama Fire College for what they've done. If you look at how this peer support started on the fire side, we had 24 firefighters gather in 2018 to get a peer support certificate. By now, over 2,000 firefighters, is that correct? So you're looking at Fire College training over 250 firefighters so far a year to get moving forward to this. So he's done an amazing job at the Fire College. One thing I would like to see as far as funding just in general, I have the utmost confidence in Director Russell and his position, his passion for this. But if there was a way that would come down the road that there be maybe a line item from the Department of Mental Health to the Fire College just specifically for mental health peer support. I'm afraid if it just got put into the budget in 30 years when Director Russell retires, that there might be a different direction that the director of the Fire College would want to go. Maybe he's interested in hazmat, but to keep the funding designated towards this topic and towards the mental health aspect of the Fire College would be one good thing I would recommend. And just lastly, touching on some of the responses I got a chance to go over, the people from their department said that they don't know anyone in their department that's suffering from peer support. I got into town late last night, threw out an overnight poll just to click yes or no. Do you know a firefighter suffering from PTSD? This morning we had 95 responses and 86 said yes. So I want to, if that puts a touch on how important this is on the fire side, I want to thank you guys all for your dedication to this. And if you have any questions for me, I'll be here. And thank you so much for your time.
Okay, thank you. Anyone else? Go ahead.
So one thing, too, I'd like to add, and Alabama Department.
Go ahead and give your name again for those.
Jason Smith.
Okay.
We don't talk about the brain. We don't talk about brain injury. We don't talk about CTE. We don't talk about TBI. I know here in the state of Alabama, we just got a lot of funding for our traumatic brain injury program. I think bringing them on board for this discussion would be great because a lot of our first responders are getting head trauma out there. And I'm sorry, this is the thing that controls everything up here and has a lot to do with it. So I think bringing them on board, that stuff's already out there. So I wanted to add that to the conversation. So, thank you.
Thank you. All right, just to recap then, so the Alabama Department of Mental Health is going to work on all these organizations, bringing them together. We'll take a look at them again in a week or two, or once they've gathered that information. LSA is going to be working also with the fiscal office and any recommendations that we may need there. And I would mind you that we are tasked with working with existing funding, but that doesn't stop us from making recommendations. Anybody else before I want to appreciate everybody being here. And listen, if you got any ideas, reach out. I figure we'll give them a couple weeks and see where we're at. How's that sound with everybody right now? Does that look like, am I missing something? I'm not sitting up here and think I got all the answers, but I think that's the road we need to head down next, and then bring everybody back together and go from there. All right, with that, I will entertain a motion to adjourn. All right, motion to adjourn. All in favor say aye. All right, we're now adjourned.